In patients with heart failure prescribed furosemide, monitoring potassium levels is crucial. Furosemide, a loop diuretic, increases potassium excretion, risking hypokalemia. This condition can be life-threatening, making potassium monitoring essential for patient safety. When prioritizing patient assessments, a client with COPD and an oxygen saturation of 89% should be seen first. Although some desaturation is expected, this level may indicate worsening respiratory function, necessitating immediate attention to prevent further complications. In assessing clients, prioritize those with a glucose level of 68 mg/dl. Hypoglycemia is a physiological emergency requiring immediate correction to prevent severe outcomes. Quick intervention can stabilize the patient and prevent further complications. For clients on warfarin, using a soft bristled toothbrush is vital. This practice prevents mucosal injury and reduces bleeding risk associated with anticoagulation therapy. Educating patients on this can significantly enhance their safety and treatment efficacy. In newborns, nasal flaring requires immediate intervention. It is a sign of respiratory distress, indicating the need for prompt action to ensure adequate oxygenation and prevent further complications. Early detection and response are critical. For clients with schizophrenia responding to internal stimuli, the priority is to ask what the client hears. This assessment helps determine the potential risk to self or others, guiding appropriate interventions to ensure safety and effective management. In Addison's disease, hypoglycemia is an expected finding. Cortisol deficiency leads to decreased glucose production, resulting in hypoglycemia. Recognizing this helps in managing the condition effectively and preventing adverse outcomes. X-ray confirmation is the best method to verify NG tube placement. It is the gold standard to ensure the tube is in the stomach, not the lungs, preventing complications such as aspiration. This practice is crucial for patient safety. Clients taking lithium should avoid NSAIDs like ibuprofen. These can increase lithium levels, risking toxicity. Educating patients on this interaction is essential to prevent adverse effects and ensure safe medication management. In laboring clients, a fetal heart rate of 100 BPM is concerning. It indicates fetal bradycardia and distress, requiring immediate intervention to ensure fetal well-being. Monitoring and timely response are critical in such scenarios. In anaphylaxis after IV penicillin, the priority is to stop the infusion. Discontinuing the offending agent is crucial in managing anaphylaxis effectively, preventing further exposure and allowing for appropriate treatment to be administered. For clients receiving heparin, monitoring APTT is essential. It evaluates the therapeutic range for heparin and the risk of bleeding, ensuring safe and effective anticoagulation therapy. Regular monitoring helps in adjusting doses appropriately. In nephrotic syndrome, decreased urine output is most concerning. It indicates potential worsening renal function and fluid overload, necessitating prompt evaluation and intervention to prevent further complications. For clients with active tuberculosis, airborne precautions are necessary. TB spreads via airborne particles, requiring the use of an N95 respirator and a negative pressure room to prevent transmission and ensure safety. In cirrhosis, elevated ammonia levels indicate hepatic encephalopathy, causing altered mental status. Monitoring ammonia levels is crucial for managing this condition and preventing further neurological complications. When taking MAOIs, avoid aged cheese. Foods high in tyramine can lead to a hypertensive crisis when combined with MAOIs. Educating patients on dietary restrictions is vital to prevent serious adverse effects. After thyroidectomy, tingling around the mouth is concerning. It suggests hypocalcemia from parathyroid damage, posing a risk for tetany. Prompt assessment and intervention are necessary to address this complication. In TPN, infection is the most serious complication. Central lines used for TPN pose a high risk for bloodstream infections. Vigilant monitoring and aseptic techniques are essential to prevent this life-threatening issue. Effective pain management is best indicated by a client ambulating without grimacing. Functional improvement is a key indicator of pain relief, demonstrating the success of pain management strategies. For a diabetic client who is confused and diaphoretic, the first action is to check blood glucose. These symptoms suggest possible hypoglycemia, which must be confirmed and addressed immediately to prevent severe outcomes.